Is daily self-pleasure healthy as you age? This natural activity that most men engage in throughout their lives takes on different meanings and effects as you age. While younger men rarely question their habits, you might be wondering if your current frequency is supporting your health or possibly working against it. The truth lies somewhere in the middle. Masturbation itself offers several health benefits, but like many things in life, balance matters. Understanding how this private practice affects your physical and emotional well-being can help you make choices that enhance your overall health and sexual satisfaction in this important chapter of life. As men get older, their bodies naturally go through changes that affect sexual function. When it comes to masturbation, your body responds differently than it did in your younger years. The time it takes to become aroused often increases, and you might notice that achieving and maintaining an erection requires more direct touch than before. This isn't something wrong with you. It's simply part of the normal aging process that happens to most men. Your body produces less testosterone as you age, which can lower your sex drive and change how quickly you respond to sexual thoughts or touch. The blood flow to your penis might also be slower, making erections take longer to develop. Even the sensitivity of your genital area can decrease over time, meaning you might need more stimulation to feel the same level of pleasure you once did. For many men, these changes can be concerning or even frightening. You might wonder if something is wrong or if your sexual health is declining. This worry is completely natural, but understanding these changes can help put your mind at ease. The truth is that masturbation remains a healthy activity throughout life, though how often feels right may change. When it comes to daily masturbation, your body has its own way of telling you what's too much or too little. Some men find that daily self-pleasure helps them feel relaxed and keeps their sexual function working well. Others might notice that they feel tired or sore if they masturbate every day. The right amount varies from person to person and can even change during different times in your life. What's most important to know is that masturbation itself doesn't cause harm to your body. The old myths about it causing hair loss, blindness, or mental problems have all been proven false by modern science. In fact, regular masturbation can actually help keep blood flowing to your genital area, which maintains the health of those tissues. Many men notice that as they age, the recovery time between sexual activities gets longer. While a younger man might be ready again in minutes, you might need several hours or even a day before you feel interested or able to become aroused again. This longer, refractory period is completely normal and doesn't mean there's anything wrong with your health. How does your body feel after masturbating? This question can help you decide if your current habits are working for you. If you feel good, perhaps more relaxed with better sleep and less stress, then your routine is likely supporting your health. But if you often feel tired, sore, or notice a drop in your mood afterward, it might be worth thinking about how often feels best for your body now. Remember that your sexual health doesn't exist in a bubble. It connects to your overall physical and mental well-being. Things like exercise, diet, sleep, and stress levels all play a role in how your body responds to sexual activity, including masturbation. Paying attention to these areas of your life can help support not just your sexual health, but your entire body as you age. Research findings show some surprising health benefits of regular masturbation as men age. Studies have found that men who ejaculate more frequently, around 21 times per month, may have a lower risk of prostate cancer compared to those who ejaculate less often. This doesn't mean you need to masturbate every single day, but it does suggest that regular sexual activity, including masturbation, might play a role in keeping your prostate healthy. The prostate is a small gland that produces fluid for semen. As men age, this gland often becomes larger, which can cause urinary problems and discomfort. Regular ejaculation helps clear out the prostate ducts and may reduce inflammation in this area. Think of it as a natural way to flush the system and keep things moving properly. Masturbation also triggers the release of hormones like dopamine, oxytocin, and endorphins, natural chemicals in your brain that boost mood and create feelings of pleasure and relaxation. These hormones can help lower stress levels and even improve sleep quality. For many older men who deal with sleep problems or stress, this natural form of relief can be very helpful. Your immune system may benefit from masturbation too. Research has shown a temporary increase in certain immune cells after orgasm, which might help your body fight off illness better. While these effects are short-term, they add to the list of ways that sexual activity supports overall health. The physical act of masturbation also maintains blood flow to the penis, which keeps the tissues healthy and may help preserve erectile function over time. Similar to how exercise keeps muscles strong, regular sexual arousal sends blood to your genital area, helping maintain the elasticity of blood vessels and supporting long-term sexual health. For men who don't have regular partner sex, masturbation becomes even more important. Without regular sexual activity, some men can experience a condition informally known as use it or lose it. The penis may actually shrink slightly over time without regular erections, and erectile function can become more difficult to maintain. Regular masturbation helps prevent these changes by keeping the sexual system active and working. Brain scans during orgasm have shown activity across many brain regions, suggesting that sexual pleasure exercises your brain in unique ways. This neural activity might help maintain brain health and function as you age. Another unexpected benefit of sexual activity. The health benefits don't just come from ejaculation alone. The mindful awareness of your body during self-pleasure can increase your connection to physical sensations and improve how you feel in your own skin. This body awareness often decreases with age, making masturbation a way to stay connected to your physical self. Do you find yourself using masturbation to avoid emotional discomfort? While occasional use as a stress reliever is normal, pay attention if it becomes your main way to cope with difficult feelings. Hit the subscribe button if you appreciate health advice. It helps us create more content you can use. The healthiest approach combines the physical benefits of masturbation with other good coping skills like talking with friends, staying active, and finding meaning in daily activities. For men taking medications that affect sexual function, masturbation can help you understand how your body responds under these new conditions. Many heart medications, blood pressure drugs, and antidepressants can change how your body reaches arousal and orgasm. Regular self-exploration helps you learn these new patterns and adapt to them in ways that maintain sexual satisfaction. While masturbation offers many benefits, daily habits may not be right for everyone. Finding the right balance for your body and situation matters most. One important factor to consider is how masturbation fits into your overall life. If it starts taking time away from relationships, work, or activities you enjoy, that might be a sign to cut back. Even good things can become problems when they take up too much space in your life. Many men use online videos or images to help with arousal. Over time, your brain can start to expect this level of stimulation to become aroused, making it harder to respond to real-life touch or natural thoughts. This doesn't mean you need to avoid visual aids entirely, but mixing in masturbation with just your thoughts and physical sensations helps keep your natural arousal systems working well. Another myth worth clearing up is that masturbation drains your energy or lowers testosterone. Research doesn't support these ideas. While you might feel tired right after orgasm due to the relaxing hormones released, regular masturbation doesn't cause long-term tiredness or lower your hormone levels. If you often feel very tired after masturbating, it might be worth looking at other aspects of your health like sleep quality, stress levels, or physical activity. Some men worry that masturbation will make it harder to perform with a partner. Actually, the opposite is often true. Knowing your body through self-pleasure can help you understand what works for you sexually, making partner sex more satisfying. Self-knowledge is a strength, not a weakness, when it comes to sexual health. For men dealing with certain health conditions, some caution may be needed. If you have heart problems, the increased heart rate during sexual activity is usually safe but worth discussing with your doctor if you have concerns. Men with skin conditions affecting the genital area should use gentle touch and appropriate lubricants to avoid irritation. And if you notice pain during or after masturbation, that's a signal to check with a healthcare provider. Physical technique matters more as you age. Using firm pressure or rough handling during masturbation can sometimes lead to decreased sensitivity over time. A gentler approach with good lubrication often provides better results and keeps sensitivity intact. Many men find that taking more time and focusing on the entire experience rather than rushing to finish improves the quality of the experience. Have you noticed changes in how long it takes to reach orgasm? This is common as men age and doesn't mean anything is wrong. Giving yourself more time and focusing on the pleasure of the entire process rather than just the end result can make masturbation more satisfying. Using lubricant becomes more important too, as natural moisture in the skin decreases with age. If you find yourself masturbating out of boredom or habit rather than desire, it might be worth mixing up your routine. Taking a short break can sometimes reset your sensitivity and make the experience more pleasurable when you return to it. Some men find that spacing out masturbation to every few days creates stronger, more satisfying experiences than daily sessions. For men in relationships, talking openly with your partner about masturbation can strengthen intimacy rather than threaten it. Many couples find that understanding each other's self-pleasure habits creates more honesty and closeness. Solo sexual activity remains normal and healthy even in committed relationships and doesn't reflect negatively on your connection or attraction to your partner. Finding the right balance with masturbation is a personal journey that depends on your own body, health, and life situation. The most important thing is paying attention to how you feel, both during and after. If masturbation leaves you feeling good, physically relaxed, mentally at ease, and able to sleep better, then your current habits are likely working well for you. If instead you notice negative effects like soreness, fatigue that lasts beyond a short rest period, or feelings of guilt or shame, some adjustments might help. Making small changes to your overall health can improve your sexual experience too. Regular exercise increases blood flow throughout your body, including to the genital area, which can enhance sensation and function. Even a daily walk can make a difference. Eating foods that support heart health, like fruits, vegetables, whole grains, and lean proteins, also support sexual health since good circulation is essential for sexual function. Stress management techniques like deep breathing, meditation, or simply taking time for activities you enjoy can lower stress hormones that interfere with sexual response. Many men notice that their sexual function improves when they find effective ways to handle the stress in their lives. If you notice sudden changes in your sexual function or experience pain during masturbation, don't hesitate to talk with a healthcare provider. These changes sometimes signal health issues that need attention, and getting help early often leads to better outcomes. Remember that doctors have heard it all before. There's nothing to be embarrassed about when discussing your sexual health. As the years pass, adapting your approach to masturbation can help maintain satisfaction. This might mean taking more time, using lubricant, trying different techniques, or focusing more on the journey than the destination. Exploring what feels good now, rather than sticking to old habits that may no longer work as well, keeps sexual pleasure a positive part of your life at any age. The bottom line? Masturbation remains a normal, healthy activity throughout life. Whether daily or less frequent, what matters most is that it adds to your well-being rather than taking away from it. By listening to your body, making adjustments when needed, and letting go of old myths and worries, you can continue to enjoy this natural form of pleasure and self-care for years to come. Now tell me, what's one thing you'll do differently after watching this video? Please share with us in the comments. Thank you for watching, and see you in the next video.